The recreational use of nitrous oxide, popularly known as laughing gas, may seem benign, even amusing in the moment. Its effects are short-lived, legal in many places, and widely accessible in whipped cream canisters or party balloons. But beneath its euphoric mask lies a pharmacological interaction of rare potency and alarming subtlety. Nitrous oxide irreversibly oxidizes the cobalt ion at the heart of vitamin B12, rendering the vitamin inactive. This seemingly minor reaction has profound consequences. With repeated exposure, even in individuals with otherwise normal B12 intake, nitrous oxide can strip away the body's reserves of functional B12 and trigger cascading neurological damage, sometimes severe, often permanent, and too frequently misdiagnosed. Unlike dietary deficiencies that develop over years, nitrous oxide-induced B12 depletion can occur in a matter of weeks or even days, depending on the frequency and dose of use. The danger lies in the unique mechanism. Nitrous oxide doesn't merely reduce B12 levels, it inactivates the vitamin itself, particularly methylcobalamin, the form required for methylation and DNA synthesis. This disrupts the methionine synthase reaction, halting the conversion of homocysteine to methionine and crippling methylation throughout the nervous system. The consequences are devastating. Myelin, the fatty sheath insulating nerves, begins to degrade. Methylation-dependent neurotransmitters like dopamine and serotonin become dysregulated. Neurons starve for the very reactions that maintain their structure and signaling fidelity. Early symptoms of nitrous oxide-induced B12 dysfunction are subtle but unmistakable to those who know what to look for. Tingling in the hands or feet, unsteady gait, numbness, weakness, mood changes, or difficulty concentrating. If exposure continues, these can escalate to full-blown subacute combined degeneration of the spinal cord, characterized by loss of coordination, spasticity, and sensory ataxia. Psychiatric symptoms may also emerge: anxiety, depression, hallucinations, or paranoia, mimicking other neuropsychiatric disorders and often misattributed to unrelated causes. Tragically, because standard serum B12 tests often return normal results even in these cases due to circulating inactive analogs, the true diagnosis is frequently delayed. The risk is not limited to heavy or chronic users. Even periodic recreational exposure, weekly balloon sessions, for example, can impair B12 status in people with borderline stores or compromised absorption. This includes vegetarians, vegans, older adults, and those taking proton pump inhibitors or metformin. For such individuals, nitrous oxide acts as a silent accelerator of an already precarious deficiency. Worse, the neurological damage that follows can continue even after exposure stops, unless aggressively treated with high-dose B12, often via intramuscular injections, and supported by methylation cofactors like folate and B6. What makes this phenomenon particularly insidious is its invisibility within mainstream narratives. Nitrous oxide is often perceived as safe because of its fleeting high and non-addictive profile. Few users are aware of the biochemical havoc it can wreak. Even many healthcare providers are unfamiliar with the specific mechanism of B12 inactivation and may dismiss the connection between nitrous oxide use and neurological complaints. As a result, countless cases go undiagnosed, mislabeled as multiple sclerosis, functional disorders, or psychiatric illnesses, while the underlying B12 crisis remains untreated. Public health messaging lags behind the science. While clinicians in emergency and neurology departments have started to report an uptick in nitrous oxide-related neuropathy, broader awareness is lacking. The cultural image of nitrous oxide as a harmless party trick persists, even as young people arrive in clinics unable to walk properly or speak clearly, with nerve damage that might have been prevented by earlier intervention. The tragedy is not just in the neurological loss, but in how easily it could be avoided through education, early testing, including methylmalonic acid and homocysteine, and prompt repletion of active B12. There's also a wider lesson here about how fragile B12 metabolism truly is. It takes only one molecule, nitrous oxide, to disrupt a complex, evolutionarily preserved enzymatic system that keeps the brain, nerves, and blood cells functioning smoothly. And because B12 is stored in limited quantities, the buffer is finite. Once compromised, repair is slow and uncertain. Recovery from nitrous oxide-induced damage may take months, and in some cases, neurological deficits remain permanent even after B12 status is restored. In the end, Nitrous oxide's danger is not its recreational appeal or legality. It is the biochemical precision with which it dismantles a cornerstone of human neurobiology. Vitamin B12, long underestimated, proves once again to be indispensable, not just for red blood cells or metabolism, but as a guardian of our highest cognitive and motor functions. And like many guardians, its absence is often only noticed when the damage is already done.